Good afternoon. My name is Cynthia Sierra, and I have the privilege of serving as the Chief Executive Officer for Manet Community Health Center. It is with great pleasure and abundance of joy that we welcome today Governor Baker, Lieutenant Governor Polito, and Secretary Sudders, and so pleased to be joined by the most amazing mayor, Mayor Tom Koch. Also, State Senator John Keenan is joining us, Representative Bruce Ayers, and Norfolk County District Attorney Michael Morrissey. And to all of our patients and community members that trust us with their COVID services, we thank them, and our staff and our volunteers that have made this work possible. So this is our Quincy Community Vaccination Site. Today we also have a team that's at Quincy High School where they're bringing the vaccines to students. And so we have a comparable team that's at Quincy High School. And then also we serve Taunton. Soon to serve Attleboro, we serve Hull. And so we have about 200 persons that we're vaccinating also concurrently this afternoon in the community of Taunton. And if we look back to March 10th, 2020, and the governor's state of emergency, it was really clear to us, and particularly when Congressman Stephen Lynch and Mayor Tom Koch called us together probably within a day of that announcement of state of emergency. At that time, it was COVID-19 testing, and how do we stand up access as quickly as we can. And so then, like now, and I wanted to recognize Command Center staff, Christine Kim, we had a partner in the Command Center. And so with the mayor and sort of the wings at our back, in less than a week, by the close of March, we started testing. We still test 6 days a week in 3 different communities at our practice sites and in community locations such as this, 21,000 tests. And as we were hoping and expecting and watching and prognosticating for a vaccine, we continued that work. Of course, our primary care and telehealth in partnership with the Command Center came in 2 additional forms. We had the pleasure of having that opportunity to do more. And so with the Command Center and Governor Baker and Secretary Sudders, isolation and recovery hotels, we had not once but twice had that opportunity to help at one of the isolation recovery hotels that was in Taunton. And this was important and very much aligned with our mission and the city of Quincy and the mayors as well, a commitment to those that were housing unstable and homeless. And so from the early days, sort of responding, providing care, symptom management and testing, we were happy to provide that behavioral health, medical pharmacy guidance twice at the isolation and recovery site. And then also we were asked again, and how could we help in Taunton specifically around testing. And so about 2,900 tests, I think with warmth and hospitality and seriousness, were offered in the city of testing. Vaccines, similar, planning and anticipating. How could we have impact? How could we, as a community health center, sort of one dose at a time, come together? Our space was too small. Called the mayor in December. The city, how can we help? It really, truly is all for one. This site was born. What came next, again, Command Center, partnership over inventory management. And we did the very best that we could. What we knew we needed, because we were running a community health center with primary care addiction services and behavioral health in 3 different geographies, we needed volunteers. We needed a call to action. So one volunteer begetted another volunteer, begetted another volunteer. And we have over 50 volunteers. We've done 65 sessions in this site alone, a high of 980 lives vaccinated to 150. And volunteers have kept coming. And a core 10 of them have come to 90% or more. Also in Hull and Taunton, the same. We offer vaccine service. We couldn't do what we do without the call to action and the community standing up with that shared commitment, that with that conviction that one dose, one life can change and impact the health of entire communities. So it has been our honor to open the week today with over 26,000 vaccines provided, and if you will, the will and the drive and the motivation and the inspiration with these volunteers to continue to do more evening sessions, walk-in. We'll continue Saturday sessions. We're doing pop-up. It might be a basketball court. It might be a high school. It might be a pantry. It might be a community center. So we have to stretch and think about how we can be more accessible to our community. So it's just such a pleasure to have your good company here today. And so without further ado, I'll turn this over to Governor Baker. Thank you. Thank you, Governor.
Good afternoon, and thank you, Cynthia, for all of the work that you and your team. Sorry that Dr. Young is out in the hallway somewhere. She's clearly part of the dynamic duo here that have made this place so special over the course of the past year. I want to thank the district attorney for being with us, and I also want to thank Senator Keenan and Representative Ayers for their leadership all the way through this period. And of course, the partnership we've had with Mayor Koch, which goes back a long way. And I remember early on when we were collecting data on how we were doing on vaccines, Manet was literally up near the top in terms of the amount of vaccine they were getting distributed and administered and into people's arms. And I called the mayor and got a 30-minute dissertation on all the great work that he was doing to support the Community Health Center and all the great work the Community Health Center was doing all over the region to support the people here on the South Shore. And in many respects, it is community health centers who time and time again have played a vital role on behalf of so many populations in communities that normally don't have some of the same access to services and to care that people have in other parts of Massachusetts. And this place in particular, whether it was primary care, telehealth, testing, or vaccinating, has been able to pivot and respond all the way through the pandemic and has been really a terrific partner to us and to the people of the communities that it serves. I do want to give a quick update on COVID-19 cases, hospitalizations, and vaccinations. Yesterday, the Department of Public Health reported 655 new COVID-19 cases out of about 56,000 tests. We're closing in on 22 million tests administered here in the Commonwealth, and we remain a national leader with respect to our testing program for COVID per capita. 438 individuals are in the hospital with COVID and 124 in the ICU. We've continued to see improvements to our public health metrics over the course of the past 4 months or so, and just since the end of March, hospitalizations are down by about 25%, cases are down by about 45%, and deaths are down by about 70%. As I said earlier, all of these metrics have dropped dramatically since the beginning of the new year, down by about 80% overall. On vaccines, in total, over 2.9 million people in Massachusetts are now fully vaccinated. We will go over 3 million people in Massachusetts fully vaccinated before the end of the week. In total, over 4 million people are either fully or partially vaccinated, and we expect that we will hit 4 million people fully vaccinated by the beginning of June, which was the projection we made several weeks ago. For several weeks now, we've continued to be a top performer in the country when it comes to administering both first and second doses per capita. We're number one in both of these categories among states with more than 5 million people, and we're number two in both of these categories among all states. 73% of adults in Massachusetts have had at least one dose, making us one of only 3 states in the country to cross the 70% milestone. We've also administered vaccines to over 60% of our total population. Almost 90% of our residents over the age of 75 have received at least one dose, a metric where we are far above the national average. And as the father of the son of a 93-year-old, I particularly appreciate that metric. And in Massachusetts, virtually everyone who gets a first dose is returning to get a second dose. That number is over 99%. So it's one of the reasons why we're pretty sure that we will hit our 4 million people in Massachusetts vaccinated goal by the beginning of June. The vaccination progress is one reason why we've been successful at reducing the spread of COVID. Thanks to the improvements in our public health metrics, we've been able to move forward on some of our phased reopenings. And effective today, as many people know, we are moving into Phase 4, Step 2, which means road races and other large outdoor organized athletic events are permitted to take place if appropriate safety measures are followed. Large capacity venues like stadiums and arenas and ballparks can increase their capacity to 25%. And over the past few months, we've been doing everything we can to ramp up vaccinations to support the continued safe reopening of the Commonwealth. This latest progress is obviously good news for all of our businesses, for our workforce, and for our communities. The progress on reopening the Commonwealth would not be possible if Massachusetts wasn't so successful at getting people vaccinated. I can't stress enough that these vaccines have proven their mettle here in the Commonwealth. They are safe, they are effective, and they are keeping people healthy out of the hospital time and time again, and it shows in our data, not just here in Massachusetts, but across the country and around the world. And it's community health centers like this one here at Manet that have been at the center of a big piece of that effort. Our community health centers have now administered over 500,000 doses of COVID-19 vaccine to their patients and community members since the rollout began. And as we move forward, we expect community health centers to continue to play an even more important role in reaching some of the hard-to-reach populations. A week ago, we announced that our efforts would shift on vaccine strategy to focus on more targeted community-based outreach, and we're working with healthcare providers, health systems, local boards of health, and community health centers like this one to build a significant vaccine distribution infrastructure that will be able to effectively reach out to, connect with, and vaccinate tens of thousands of residents each day, many of whom would have difficulty pursuing vaccines under the more traditional approach. But once you get to the point where almost 3/4 of your population has been first dosed, you need to start pursuing, as we are with our partners, additional strategies to get to that last 25%. We still have a lot of work to do to reach the folks who haven't gotten vaccinated yet, some of whom are obviously part of the wait-and-see community or are still considering it. But our goal is to reduce as many barriers as we possibly can to provide access and information and hope that they will join us in getting vaccinated here in the Commonwealth. That's why this new phase of the rollout is focused on things like mobile clinics, which Cynthia talked about, more walk-in opportunities, which we saw some of here earlier, and a greater focus on small-scale operations that can reach people where they are. Beginning today, walk-up appointments are available at all 7 mass vaccination sites as well, and going forward, we'll be relying even more on places like this community health center to play a key role in our local outreach, along with many trusted community partners who we've been working with since the beginning of this rollout campaign. Community health centers, as we all know, are trusted partners in the neighborhoods they serve. They have deep relationships and knowledge of the populations and the patients in the communities that they work in, and they've bridged a gap in many respects between larger healthcare institutions and local organizations like churches and community centers to facilitate clinics and to get people vaccinated. Manet is known as a leader when it comes to our community health center performance. They have locations in Taunton and Hull and a big presence right here in Quincy. They've run targeted clinics to get vaccines to home care agencies, first responders, congregate housing, homeless shelters, and many more. All in, they've recently passed the 26,000 vaccinations delivered here in the Commonwealth mark. Congratulations to you and the team, Cynthia. And as we go forward, we expect and anticipate that places like Manet will continue to be a crucial partner of ours as we work to get vaccines into more and more people's arms over the course of the next several weeks and months. We are certainly grateful for everything you and your team are doing. We're certainly grateful, Mr. Mayor, to the role that the city has played in enabling a lot of what Manet's been up to be successful, and we continue to rely on the support and collaboration of our colleagues in the legislature on so many of these initiatives. And with that, I will turn it over to Secretary Sudders.
Governor, Lieutenant Governor, Good afternoon. Cynthia, so good to be with you and the team in Quincy. I want to thank you for all your efforts. Our community, as you've heard from the governor, our community health centers have played a critical role in our overall vaccine effort, both by being that very trusted source of truth and information within their communities, and as you can see here, in the vaccination efforts. It's hard to not pick up the enthusiasm when you walked through the area where people are being vaccinated. As we continue to vaccinate residents of the Commonwealth, protecting everyone's health and safety remains paramount, and that includes ensuring access to health insurance. In addition to providing health care, administering vaccines, Manet also helps sign people up for health insurance coverage at the connector. Open enrollment at the connector remains open through July 23rd, so now is the time for individuals who don't have insurance to get covered. The Massachusetts Health Connector has lower premiums available through new financial help, providing hundreds of thousands of people with additional subsidies to make health insurance more affordable. For the very first time, some people who earn more than $51,000 a year are eligible for subsidy, on average receiving about $700 a year to help paying their monthly premiums. Individuals who currently buy their coverage off the Health Connector can look and see if they qualify for lower premiums and switch plans. If they stay with the same carrier, their deductibles and out-of-pocket costs so far this year will not reset, which we thank our carriers for helping get through this year. Individuals who are already receiving help paying for their coverage through Connector Care will also see lower premiums. With low copays and no deductibles, Connector Care provides truly affordable coverage to those who need it most. Health insurance, as we know, delivers the peace of mind that if you're sick or injured, you can see your doctor and get care without dealing with large health care bills. It provides health and financial benefits to both you and your family. So if you need health insurance, you can go online anytime at masshealthconnector.org. Find the right plan for you and your family, complete an application. But if you need help sorting through options or just have basic questions, there are navigators, like here at Manet Community Health Center, who provide the assistance helping you fill out your application, understanding your options going forward. Again, open enrollment for the Connector will continue this year through July 23rd. Stay healthy, get connected. And finally, I just want to give one more shout out to Manet for providing the clinical supports and the behavioral health services for our isolation and recovery programs, the hotel in Taunton. You served more than 574 homeless and housing insecure individuals over these past 2 times. Hopefully there will not need a third. But with that, thank you, and I will turn it back over to the governor.
Questions?
The infection rates have gone down considerably since the fall, hospitalization, vaccinations. Is it time to declare victory over COVID, and do you anticipate rescinding the emergency order anytime soon?
So we've continued to see positive progress on all of the public health measures that we pay attention to. But what I would say is that we're going to continue to make decisions based on data, and the one thing we've said all along is any decision we make with respect to reopening, we want it to be a positive one that is sustainable. And that makes us, I think in some cases, a little more cautious than some others. But if you look at how this has worked across the program since we first opened up the economy, it's just about a year ago, right? May 18th. Generally speaking, we have not had some of the blowback that have happened in other places when they opened up a little more quickly.
Governor, is there any hope, some business leaders are hoping for a July 4th reopening rather than an August 1st, so they can get that extra holiday weekend in? You just cited a lot of really positive metrics. Is there any hope that you might move it up, that reopening date?
Well,
date?
we said when we originally proposed the August 1st date that there were several things that were going to determine whether or not, that was like the outside date, right? That was what people wanted from us was, what's the outside here? And we put the August 1st date out there because we believed by then we would reach, even if vaccines started to slow down, even if we stopped seeing people get vaccinated and all the rest, that we felt that date would probably work. But we said at the time that if people continued to get vaccinated and people continued to get fully vaccinated and we continued to see progress on some of these other metrics, that we would consider moving earlier. I would say we've been pleasantly surprised by the continued participation of people here in the Commonwealth. At this point, if everybody who has a first dose comes and gets a second dose, we will hit 4.1 million people sometime in very early June. But obviously, this is the sort of thing we're going to continue to pay attention to.
Governor, you had said that walk-ups at Gillette were not going to be available, and I think you just said all 7. Has that changed?
I don't think I said it wasn't.
Last week, Gillette was not included in the walk-in.
Was it 6?
Last week, yeah.
So we did change our position on that? You can go ahead and talk.
I want you to see the Get Connected face covering.
Stay healthy. Good.
I'm the chair of the Connector Board. So last week, we announced 6. Gillette, just because of the size, their scale, they felt they needed a little bit more time to make sure they had enough people at the front end in order to accept walk-ins. So they actually started over the weekend, people started to walk in, but it's now official. So walk in at all 7 of our mass
And
vaccination
How many
sites.
people would you say are taking advantage of this? Is it almost like you don't need an appointment anymore? You can just, if you wanted to go to one of those sites?
You don't need an appointment anymore to go to one of those sites. And it's also true at many of the retail pharmacies that they're now accepting walk-ins as well.
So the traffic at the Max Finder site is probably down to just about nothing?
No, they're actually, we were pleasantly surprised. People are still going onto the pre-registration to sign up. I think for some people that just provides that certainty, like you will get an email or a text from us for an appointment, but people can go on the Max Vax Finder and just make appointments or walk in. So we're encouraging people to walk in, as they also are doing here at Manet, trying to take away, as the governor said, any real or perceived barriers for people.
And finally, are we getting Johnson & Johnson shipments still? Is that still like a big part of the vaccination plan here? Or outgrowing part?
J&J is a small piece of our overall vaccination. I think for this week, it's about 10,000 doses for this week. But it's very much an important piece, particularly for mobile and the like, and they do it here at Manet. You offer all 3.
Today, in fact, yes.
Right.
all 3.
Right, all 3.
One other thing I'd say about the appointments is, remember, everybody who got a first dose probably has an appointment to get a second dose. So there's still a lot of appointments that are scheduled. I mean, I would guess if we do 70,000 appointments, if we do 70,000 vaccines today, I'm guessing 45,000 of those, 50,000 of those will probably be second doses, which will all be driven by appointments. Is that about right?
Yeah, that's about right.
Governor,
In addition to going to a more local model, what are some other ideas or things the city is doing to help push the last 30% or so of folks that might be nervous or hesitant about getting vaccinated?
I do think the walk-in stuff is a big deal with respect to that. We've had several places that have said to us that the walk-in volume they get is actually significantly greater than the appointment volume they get, which just speaks to the fact that appointments, well, for grown-ups, for lack of a better word, we like to have the scheduled appointment. It works for us. For a lot of other people, the opportunity to just walk in, walk up, get vaccinated is an easier play for them. The other thing I would say is that I expect, if and when the feds make a decision on the over 12-year-old, the 12-year-old and up population, I expect that one will end up becoming a lot of walk-ins, and that will end up rolling out in a variety of ways. You'll see a lot of pop-ups around that. You'll see some at schools. You'll see some in supermarket parking lots. You'll see them in a variety of different places, and they're going to be based on this idea that you really want to catch people where they might be and with an opportunity to engage them and get them vaccinated.
Governor, you or your team tweeted out a little while ago that you're going to be appearing with President Biden tomorrow on this topic. Could you tell us a little bit more about that? Is that a virtual event?
Yeah, it's a virtual event. There are, I think there are 6 governors involved, and it's basically to talk about how to reach and deliver vaccines to either folks that are part of what we would call the hesitant community, or folks who are part of communities that are just hard to reach and need more help to get vaccinated. And we'll talk about some of the partnerships we've had with folks like Manet and others, and some of the work we've done with mobile outreach. I mean, some of our hospitals have actually run some really successful pop-up programs as well. Boston Medical Center is running programs with churches and community health centers and senior centers and youth centers, and I mean, there's there's a lot going on in that space that's, I think, made it possible for a lot of people to access vaccines who wouldn't have been able to otherwise.
Governor, do you think you could see reducing the mandate for masks indoors at any time? Or is that solely something you're going to go off the feds and wait for them to give you some instruction on that?
I've always thought of the CDC as sort of the guidepost on a lot of this stuff, and in many cases, we've made adjustments to their recommendations based on what we saw going on here in the Commonwealth. I keep reminding myself that they worry about 50 states, I worry about one. The facts on the ground aren't always the same in all 50 states, but I certainly think that for us in the short term, the message has been, getting vaccinated is the fastest and best and easiest way for everybody to get back to what I would call normal. And the CDC's guidance, I think, is starting to catch up with the fact that if you are vaccinated, you can do things with other vaccinated people, and you don't necessarily. I hugged my dad when I saw him on Sunday, and it was a big toothy event for both of us. But I think I think one of the things that I would just stress to people in Massachusetts is the more people that get vaccinated, the faster our case counts go down, and the faster our hospitalization rates go down, and the more likely it will be that we will all be able to do things that we love and want to do, because we won't have to worry about infecting someone else and won't have to worry about somebody else infecting us.
But does that mean the mask mandate, since we're ahead of the rest of the country, you might choose to drop the mask mandate inside ahead of the nation?
I think we focus primarily on what I would describe as the data and the studies that come in. The data and the studies on outdoors are pretty clear at this point. But masks, generally speaking, if you can't keep your distance and you can't engage in what I would describe as safe activity indoors, you should wear a mask.
So, Professor, what's your reaction to the DeRosa's lawsuit now being petitioned to go to the Supreme Court on the
Yeah.
state of the
I mean, I guess what I'd say two things. One is we don't comment generally on pending litigation for all kinds of reasons. But the vast majority of the guidance and the advisories that we've put in place over the course of the past 15 months have been pretty consistent with the public health recommendations that have come from either the feds or from our colleagues at DPH, and are pretty consistent with what most other states have done as well. And we're now on the back end of this, and if the Commonwealth and the people of Massachusetts continue to perform the way they have in terms of getting vaccinated in the weeks ahead, I think we could be in a really good place in a fairly reasonable period of time. But I think for the most part, what we've been up to and what we've done has been pretty consistent with what most others have done as well.
Last question. Can you shed some light on the emergency order, when you might rescind that? Or, would that be rescinded at the time around August 1st when things do fully get reopened? Or what would be the benefit of maybe not rescinding it at that time?
We're still trying to figure out some of the issues around the order and the supplemental guidance and advisories that sit underneath it. I guess what I would say is that it's our view that by the time we get to August 1st, which is the current sort of end of a lot of the capacity rules and the guidance and all the rest, that would certainly be a time at which we would go to some sort of a standard that would be what I would call traditional public health standard, and not something that would operate under the the rubric of an EO.
Thanks, everyone.
And thanks for coming, guys, and thanks again to Manet.
Question about transparency in the state police. We've heard that a couple of troopers have been let go recently, including one who's dishonorably discharged, and been having trouble getting information about why they were let go. Do don't you think taxpayers have a right to know, why troopers are getting the axe?
Most of the time on personnel matters, there's not usually a lot of transparency in the public sector or the private sector. One of the reasons we were so aggressive about creating a post commission was we wanted to create an entity that could serve as kind of the state clearinghouse and arbiter for decisions about internal affairs investigations, complaints, certification standards, and all the rest. Because one of the major issues we were trying to address there is if somebody was removed from a police department, dishonorably discharged, or for some other negative reason, we wanted to make sure that the Post Commission was in a position to inform any other law enforcement agency that might be interested in talking to that person what the situation and the circumstances were. But it's not unusual for HR issues to be treated as a quote-unquote confidential manner. But we absolutely believe a big part of why we were anxious to create Post, even before everything, all the awful stuff that happened last summer, was because we felt we needed a clearinghouse around, especially around law enforcement issues with respect to that stuff.
And when will they be adjudicating those kinds of cases?
Pardon me?
When will the Post Commission be adjudicating those kinds of
Well, remember, the commission itself was appointed about 2 weeks ago. We're going to file funding for it. We'll figure out a way to help them operate in the meantime. But their first major assignment is to certify the existing law enforcement community in Massachusetts by the end of the calendar year.
Thank you, everyone. Requiring kids to get the vaccination before getting back to school, like a month if it gets approved for kids?
Well, we've been big believers in what I call, incentives and making sure there aren't any barriers to getting vaccinated. And that's been our approach all along, and it's been a pretty effective one. And I think that's probably the approach we would pursue going forward on this stuff as well.
Thanks, guys.